Hi, and we're back, and we're going to continue our conversation with Dr. Shirley, um, and it's going to be about hypertension in pregnancy.
Yes.
Um, so, I what are some of the causes of hypertension? Maybe we should back that up. I mean, does it mean if you have hypertension before you're pregnant, you're going to get it, or do you get it when you're pregnant?
Well, so there are persons who have pre-existing hypertension, as in there's hypertension before pregnancy. So you have hypertension, chronic. It's called chronic hypertension, and then there is pregnancy-induced hypertension, right? So when you have chronic hypertension, that puts you at risk of having worsening hypertension in pregnancy, or even the worst case scenario, what is called preeclampsia.
Mm-hmm.
So you can have chronic hypertension with superimposed preeclampsia. And it has to do with the hormones of pregnancy, developing pregnancy-induced hypertension, the hormones of pregnancy, and really how the placenta was formed, the vessels within the placenta, how they were developed.
Mm-hmm.
And in terms of the complication of this hypertension in pregnancy, that is preeclampsia now, having it's a widespread vascular inflammatory response, wherein there is an increase in toxic substances.
Mm-hmm.
The names you might find a little bit over the top, but it's a systemic inflammatory response as well,
Mm-hmm.
where these chemicals that are being produced affect the vessels throughout the body.
Well, let's back it up a little bit.
So, go ahead. Yeah, before we get into all that.
If you're saying that when the placenta is being formed, something happens that makes it get,
Right.
weird.
Yes, so it's an abnormal placentation, and really the vessels within the placenta take a certain form when you're pregnant in order to deal with the increased blood flow. And if there's an inability to conform to the expected changes, because in pregnancy you have a higher increased blood flow. So if the vessels are not they're not formed in such a way where they can accommodate this increased blood flow, then you can develop the preeclampsia. That's one of the proposed pathophysiology behind it.
So is it caused by, what is this abnormal forming caused by? Is there?
Well, there really, it may be genetic. There are so many different risk factors. It may be genetic. It may be due to pre-existing disease. It's there to definitively say. I think it's really multifactorial.
Okay. Is there, for sure, smoking causes lung cancer, for instance, but is there something, does smoking have an effect? A woman who smoked prior to being pregnant, does that cause high blood pressure or preeclampsia?
Well, smoking is one of the lifestyle practices that's associated with chronic disease. So many different, it makes every chronic disease, in the general sense, worse.
Right.
So once you're smoking, you're at risk of having hypertension, and especially if you live a sedentary lifestyle. So, and smoking is never good, especially in pregnancy.
Yeah.
So, I would say that that's something that may be a factor.
Mm-hmm.
How strong a factor, I wouldn't be able to definitively say, but certainly smoking causes a lot of issues with respect to oxygenation of the baby, issues with the separation of the placenta. There are lots of issues and complications from that practice.
But that's even if they stop smoking after they find out they're pregnant?
Yes.
Oh, okay.
Yeah, especially for many years.
Oh, okay.
Sometimes what is done prior to pregnancy really does influence what complications may arise during the pregnancy.
And if you're like overweight, or does that play a factor in having high blood pressure?
That is a risk factor as well.
Okay.
Obesity.
Of high blood pressure or
high blood pressure, of diabetes. Mm-hmm. Well, as I had touched on, pregnancy-induced hypertension, the adverse complication or the severe end of the spectrum is preeclampsia and eclampsia. So, and it's all considered pregnancy-induced hypertension.
Okay. The producer in there right now asked, what about alcohol?
The same.
Yeah. This is someone who, say, maybe had 2 drinks a night or 1 drink prior, before pregnancy. We're not even talking the insanity of being pregnant and drinking or smoking, right? Please tell me there's nobody out there who does that.
Well, I wouldn't be able to definitively say that 1 or 2 drinks prior to pregnancy will cause this or that kind of complication. But certainly having a lifestyle of many years of smoking and alcohol will have its effects with respect to you developing chronic hypertension, developing diabetes prior to pregnancy, and all these chronic illnesses.
Okay. So you're pregnant, and what do you do to mitigate against becoming hypertensive? Is there?
Well, this is prior to getting pregnant.
Yeah, and being pregnant.
Well, so prior to being pregnant, exercise, starting off your pregnancy at a good weight, and ideally normal BMI. These things definitely do help to decrease your risk, because of a high BMI, especially greater than 35, puts you at significant risk of developing hypertension in pregnancy.
Okay.
So, if ideally weight loss and having, cutting, if you have a high carbohydrate intake, cutting down on that and cutting down on fats as well. And generally eating a balanced diet, having a healthy lifestyle certainly does start you off on the right foot when you get pregnant in that first trimester.
Okay.
Helps to decrease your risk.
Okay. How can is it something that you as a OGYN look? You look at your patient, you say, she has high blood pressure.
No.
They don't go around with a little blinking sign?
No. So, first of all, at the antenatal appointments, and why it is important to keep your appointments is because we screen for hypertension in pregnancy, and we screen for preeclampsia at the antenatal visits, whereby we always check blood pressure. We always check your urine. These are screening tools to see if there is any signs of preeclampsia. So, and depending on the severity of the blood pressure, and if there is high protein levels in the urine, and depending on your symptoms, we make a decision as to how severe or how mild, and we determine if you need admission and further investigations. So the antenatal visits that's where it all starts, which is why whatever your schedule is, whether it's depending on your gestational age, if it is monthly or every 2 weeks, you should always keep your appointments, because again, really, it's silent. They usually say that hypertension, even in non-pregnant patients, it's a silent killer. You may not have any symptoms, when it is just about starting. However, if you start to develop preeclampsia now, that's when you may have symptoms. You may have symptoms of headache, blurred vision or visual disturbance, or seeing flashing lights in your vision, feeling nauseous, vomiting, having upper abdominal pains, and you may even see So now this is variable, but you may see significant swelling of your legs. Now we expect some amount of swelling to see some of the ankles, that is. Some amount of ankle swelling as you progress throughout the pregnancy, especially in the third trimester and even postpartum. However, if you see, a sudden significant increase in swelling of the ankles, and if you notice your hands in particular are swollen and your face is swollen, that is something you definitely need to go to the hospital about if you're pregnant, because usually the swelling is is dependent at your ankles, but seeing significant facial swelling and swelling of the hands is definitely something to seek medical attention about, because it may indicate preeclampsia.
So, are you saying that preeclampsia can exist? I always, when I heard of it, always thought about it that you got it just prior to delivery. But what I'm hearing is that it could be developed at any time.
In the second, it can start from the second trimester. The third, it can start in the third trimester, and it can start postpartum.
So, if you get preeclampsia in the second trimester,
any time around 20 weeks or thereafter.
What do you do? How do you treat it?
Well, treatment, we treat the blood pressure. There are various, it all depends on your gestational age, what drugs are needed, and so forth. But I'll get into the primary way that we treat this hypertension is by antihypertensives.
Right.
If you have preeclampsia, there are drugs such as magnesium sulfate that may be used depending on your gestational age. You may need to even get steroids to help with the long maturity of the baby, because really the definitive way to treat it is delivery. Because once the baby and the placenta is delivered, it is expected that there would be some improvement in the clinical scenario.
Can you go in and manipulate the placenta to make the blood go open the vessels so the blood can go faster?
If there's an invasive procedure?
Yeah.
No.
No, I was just like, if that was like in super high risk cases, you know what I mean?
No, really, at this point, the way to the definitive treatment is delivery, so the patient is stabilized first with the various drugs, and then there's a plan for delivery.
So it's really, as you said before, it is really critical that you get your checkups on schedule.
Yes, and not to miss your antenatal appointments.
And if you feel anything, come to the doctor right away.
Yes.
Yeah.
Especially those symptoms.
Of swelling. We're talking with Dr. Shirley. We're talking about pregnancy. In particular, we're focusing on hypertension in pregnancy. And if you have any questions, you can call in 1-800-534-8255, or you can WhatsApp me on 345-925-3030 with your questions. So, why is... I've never been pregnant. I've never had a child, but even the thought of preeclampsia kind of tickles me with fear. Like, ah!
Well, it can be prevented with early interventions. So if you're at a stage where the blood pressure is not severely elevated, there isn't any sign of any multi-organ damage or dysfunction, you can be treated with the hypertension in pregnancy can be treated with medications that you can take at home, right? However, it's when it is pretty much out of control, or there are signs of either kidney damage or liver damage, or if there is any changes in your your sensorium. So if you start to be confused, or and on the farther end of the spectrum, eclampsia, where you start to have seizures, that's when it's pretty much an urgent scenario. So yes, the way we do it, the primary prevention is to come to your antenatal appointments, ensure that you don't miss the appointments, because that's really one of the things that we're screening for.
What else do you tell mothers about hypertension?
What else? When you're seen in the clinic, you're assessed, especially in the first trimester. Your risk factors for developing preeclampsia is assessed. And
what are you looking for?
So risk factors may be genetic. So if you have a mother, if your mother had preeclampsia, then your risk of developing preeclampsia is about 20 to 25%. If your sister had preeclampsia, the risk is around 35 to 40%. So we look for genetic factors. We look for a history of previous preeclampsia or pregnancy-induced hypertension, obesity. Sometimes, if you also have a history of diabetes, or if you have kidney disease, or if you have some kind of collagen vascular disease, these states, these chronic illnesses really do increase your chance of developing preeclampsia, and there are strong risk factors. So we look at the risk factors, and in the first trimester, in the booking appointment, we may make a plan. So, for instance, we may determine, so there are some studies now that strongly indicate that drugs such as low-dose aspirin, given toward the end of the first trimester, early second trimester, may be beneficial in reducing the risk of developing this preeclampsia. And there are ultrasounds that there are different things that we look for in ultrasound that may help us to identify if someone is at increased risk. The flow through the uterine arteries, for example. For those patients who have, some studies have been also shown that in women who have low dietary intake of calcium, or they have low levels of vitamin D, calcium supplementation and vitamin D supplementation may help to prevent preeclampsia.
Okay. So, does it follow suit, or is it a good indicator, I should say, that if someone has gestational diabetes, they will be hypertensive as well?
No, I mean it's not that clear cut to say that they will. I mean, it's a risk factor. They're at risk, but it's not such a high risk that you can say definitively that once you have gestational diabetes, that risk of hypertension. But the risk certainly is there, and it is screened for at these visits. And if you have a high risk, then you may have more frequent visits with your obstetrician, where you're screened more frequently.
And if you've been pregnant before, you've delivered, and you had preeclampsia or eclampsia, what then? Should they get pregnant again?
Yes. I mean, the risk of developing preeclampsia again in the second pregnancy is around 15%. So the risk certainly is there. I don't know if I would say that you should not get pregnant, but certainly having had preeclampsia, we could now institute low-dose aspirin, in the early second trimester. You could ideally put plans in place, good preconception planning, trying to exercise, eat right, start taking your prenatal vitamins and so forth, a few months before getting pregnant, so that you start off with a normal BMI, hopefully, or there is some weight loss. As I just mentioned, those things put a patient at risk. So it's, you can do some lifestyle changes prior to getting pregnant, and when you do get pregnant, we can try to minimize this risk with certain modalities, such as starting this aspirin and the vitamin supplementation and so forth, and more detailed screening with ultrasound.
Does stress have a factor in?
Well, anecdotally, stress has a factor in everything. Mm-hmm. So yes, if you have many stressors, especially at work or at home, yes, you do have patients who may have elevation in their blood pressure during pregnancy.
I mean, do you work with, because there's some women are in high stress jobs, and do you work with them to find ways of breathing? Is there what's they called? What do they call them? Doulas. Doulas. Yes.
Well, there are doulas available on Ireland. I am not. I don't have a list with me, but they certainly are. However, as it relates to stress at work, if I see that stressors at work are causing a patient to become unwell while pregnant or having elevated blood pressure, give them some time off, because having such high stress, working in a high stress environment certainly can have a direct effect on how well you progress in the pregnancy. And yes, even if you're not pregnant, your blood pressure can go up.
Yeah. Does the high blood pressure affect the baby? I mean, he must come out like...
Yes, it does, because as it relates to the placentation, the baby can become small for gestational age or growth restricted. It can affect the placenta, so for instance, placental separation, the placenta may separate from the wall of the uterus, and that really complicates things, where internal bleeding is concerned, risk of losing the baby, because if the baby is no longer getting blood supply, then that will affect the baby. So preterm delivery, because really the treatment is really delivery, and so depending on the gestation, it may be a preterm situation. So we try to temporize as much as possible, weighing the prematurity versus the severity of the disease. However, it's an individualized approach.
If do you, with someone who's experiencing hypertension in pregnancy, do you recommend a natural birth, or is that an automatic?
Well, so
cesarean birth.
Natural is the default way. I mean, a cesarean section would only be done for obstetric factors, really. It depends. So we would. Again, it's an individualized approach. So ideally, vaginal delivery is first choice. However, we have to try as best as possible to expedite this. So we may induce. However, there's a certain window that will allow weighing the severity of the disease versus how the labor process is progressing you know. So it's an individualized approach.
Okay. I mean, and it sounds like you're willing to work with.
Yes, certainly. That's, yeah.
I mean, if you don't mind me saying this, you are in a high stress job because you're a doctor.
Yes.
You're delivering babies, and you in fact are a mother.
Mm-hmm.
Okay.
Yes, that's true.
So I mean, it can be done, and it's done all the time. So what advice would you give someone right now who is pregnant and maybe experiencing something like this? What would you say?
Well, first thing, to ensure that you keep your appointments, and recognize that your doctor may need you to come in a lot, maybe more frequently than the typical low risk, in quotes,
right,
patient, right? I would recommend rest, as much as, especially if you're in a stressful environment. If you're on medication, antihypertensive medications, ensure that they are taken. Never ever take them lightly, because again, you may have a very elevated blood pressure and not yet know because there are no symptoms, and then you start to develop consequences, the severe end of the spectrum,
right,
which would be preeclampsia, and it would be too late.
Okay. Well, Dr. Shirley, would you like to tell the audience how they can reach you and what organization you work with?
So you may reach me at the CTMH Doctors Hospital. I'm an obstetrician there.
Mm-hmm.
And we have a very friendly staff. If you would like to book an appointment to see me, feel free to do so. The hospital has been around for a very long time and very structured and organized.
All right. Well, thank you so much for being on for The Health of It. Tune in next week. We're going to be talking to Ms. Carol Burnett about finances and your health and how to work together to drop the level of stress. Thank you for being on for The Health of It.
The Cayman Islands Civil Service Association would like to inform their members that the CICSA office, located upstairs the Hospital Road Plaza, is now staffed for your convenience. Office hours are Mondays 10 a.m. to 3 p.m. and Thursdays 1 to 4 p.m. For information and assistance, you can call 946-7330. You can also email cicsa@gov.ky. That's CICSA@gov.ky. CICSA, working hard to promote and protect the interests and welfare of its members.
Refilling and transferring your prescriptions have never been this easy. Simply go to healthcarepharmacy.ky and follow the easy directions from your desktop, mobile device, or tablet. All you need to do is pop into Healthcare Pharmacy in Grand Harbor to collect your prescription. They're open 8 a.m. to 10 p.m. Monday through Saturday and 10 till 6 on Sundays and public holidays. No waiting in line, no wasting your lunch hour, no stress. Just easy online prescription refills and transfers from the pharmacy that has been caring about your health for 25 years. Call 947-8900 to speak to a pharmacist or go to healthcarepharmacy.ky and make life easy.
For the Health of It, Radio Cayman's premier health show was brought to you by Healthcare Pharmacy and the Cayman Islands Civil Service Association.
This is For the Health of It with Tara Bush. Satisfaction is guaranteed 24 hours a day, whether it's music or information.
From Grand Cayman to Cayman Brac to Little Cayman, we've got you covered.